Thanks for joining us again with RC Hospice Talks. We're here today to talk about nursing and nursing visits in hospice. My name is Esther Narcissian. I'm the Director of Operations.
I'm Tom Rupp, and I'm the chaplain.
I'm Kelsey Murchison, RN Admissions and Case Manager.
I'm DJ Foster, RN Case Manager.
So throughout the years, working in hospice, a lot of times patients don't know the benefits of what it is when a nurse visits a patient. So I would love to hear firsthand from DJ and Kelsey today of what your visits entail and what benefits do the patients get from your visits.
So when we go out and make a visit, we are obviously assessing the physical status of our patient, and we are also managing their medications, providing spiritual care or emotional support to friends and family or whoever may be involved, and just getting a general idea of the sense of how everything's going, if there's any changes that need to be addressed or things that need to be added to the plan of care.
Another great thing is they get DME equipment, so like if they need oxygen.
So DME, just to be clear, is durable medical equipment.
Yes, sorry.
No, it's okay.
Yeah, so they can get like a hospital bed. Sometimes, sleeping in a regular bed gets to be too difficult, and it's really hard to transfer.
So you need to elevate them.
So we're able to get a hospital bed out, depending on their status. There's air mattresses versus regular mattresses. So the air mattresses alternate air to help kind of prevent those pressure sores.
Instead of moving them as often.
Instead of having to move them, you still want to turn them every 2 hours,
course.
but it just helps. It's another thing to help prevent. But if they're able to get up and down on their own, they don't always need that. If they need oxygen, we are able to provide the concentrator. So that's the big thing that just stays in one place, as well as portable oxygen. Different things like that, walkers, wheelchairs, so when they need those things as things progress.
So you assess them, you order them, and then they bring them.
Yeah.
One thing I've always wondered, and actually I've seen it at quite a few visits, is whenever it comes to pain, you help with the pain control, pain assessment, but how would you assess a patient's pain who is unable to talk?
Well, there's a number of things you could do as far as assessing someone who's nonverbal. You can look for visual cues, furrowed brow, facial grimace, things of that nature that they may be unable to speak but show you that they're in pain. Another thing is assessing their vital signs. You can often see an increase in blood pressure or heart rate if a person's in pain versus at rest. They may have a different set of vitals that could clue us into that they may be.
Another thing is guarding. So if you go to touch their stomach and they move their arms to block you, it's a sign of pain.
I mean, I always love hearing these because I myself have grandparents who sometimes are, too prideful, or they don't want to tell you that they're in pain, and they're that, I got this, I'm fine, but you want to help them and you want to notice what telltale signs are telling you that he's not or she's not comfortable.
And even for me, for those who are able to speak, I've learned it in my repertoire to also still ask the question. That's the question. Are you in pain? And it's what few times I've gotten a positive response, yes, is then when we contact our nurses. Another thing, real quick, I've enjoyed, there are a few times when I've been visiting a patient and the nurse is also there, and it's cool to see, taking your temp, taking your blood pressure, listening to your heart, some of the basic stuff that goes into every visit, every time. And that's been interesting too. So those are two things I've picked up on that I've added into my set of behaviors when I go to visit a patient, and especially the question about pain. Now I can, of course, do the other non-audible things, but anytime there's a question, we just get word to the nurses for sure.
Another thing is we try to keep our patients with us. So it's not like I go and see a patient once and then DJ goes and then another nurse goes and then another nurse goes.
So there's continuity.
There's the continuity of, so DJ will be able to say, okay, I've seen them, for 3 times a week for the last 2 weeks. They're totally different today. Something's changed.
That's awesome. So you can tell.
Yeah, you're able to build that rapport, that relationship. So You know your patients.
I got, and that's what I love. Like they literally do become somebody who's important to you, like a family member.
Yes.
Where, okay, you weren't like this yesterday. And as far as communication, do you feel like gaining a patient's trust is easy?
For the most part, sometimes they're open to nurses. Sometimes they're not. Sometimes they're like, I don't want to talk to you. And so you just kind of work at it. You work at that relationship. And, a lot of times bringing in the social worker or the chaplain, they kind of are able to open up a little bit more with those other people that are not just medical.
I see.
And that's the magic word, relationship, because
Yeah.
you tend to trust those you know.
Mm-hmm.
Yeah.
If they don't know you, a patient doesn't know you, I can understand. But for those few, over time, they realize that you have their best interests at heart,
Yeah.
and they'll begin to open, I imagine.
That's awesome. That's awesome.
It does take time. Trust is definitely something that's earned, not just given.
Of course. Is there a difference in your visiting, whether it's a boarding care, an assisted living, or a home? Are there specific steps you take to do these visits? Like, tell me about your average day.
Well, depending on, everywhere has different regulations. So like if you're going into an assisted living, you check in at the front desk first. You go in, you see your patient, then you check in with the med tech, you check in with the nurse that they have on staff. Basically, you have to check all the boxes.
So you do educate as you go.
Yes, you
It's
educate.
not just your patient and you leave everybody else.
No, you want to make sure that everybody's on the same page because you want to make sure that your patient's getting the best care possible.
Of course.
So you want to make sure that the med techs know that what you're doing. You want to make sure that the nurse that they have on staff is on board, so that way everybody's in a boarding care. It's similar. There's not usually a nurse. It's like the caregivers that they have. You just want to have everybody be on that same wavelength. In a home, you're usually just talking to the family member or their caregiver, depending on who they have there.
Awesome. And in the homes, it's usually with the families that you're talking to. Awesome. I do know a lot of times, like, the reason I love that Tom's here is Tom, because him being a chaplain and people get, we talked about that. We're actually talking about it in an episode to come about how people get so scared because they think of the last rites, or what's it called now?
Sacrament of the sick, or sacrament of anointing.
So I love that Tom's being able to be introduced with the nurses on the visits, because honestly, just to talk about like a little bit what Tom does is, he's just that amazing listening ear when the nurses, come and it's all medical. Not all the time, but mostly. Tom comes and it's kind of like the fun part. You just come
And I was just thinking of a certain patient that we visited together, and that actually works really well because we're doing that fun part or whatever, the easy part or the light talk with the patient, while DJ is also checking vitals and asking questions, and it's a cool dynamic to be able to all of us working together like that. I like that a lot. A lot of my visits are just by myself with the patient, but I'm really liking the ones when I'm with the nurse. That seems to be very beneficial if the patient doesn't mind too much company. That seems to be the issue. So if it's, I don't want but one person, okay, we accommodate for sure.
Here's another great question that I actually love this question, because I myself, before hospice, let's say being a kid, you don't really hear the word often. So imminent, how would you describe imminent, DJ?
Imminent means someone is nearing that last journey. They're showing a decline in how much they're eating and drinking, sometimes none at all. They're needing sometimes more oxygen. They might not have been on oxygen ever before in their life, but now they need it to keep the level of saturation at where we want it. Or they may just be sleeping a lot more throughout the day, sometimes all day, and only waking just for a few moments to say a few words, sometimes not at all. And everybody's a little different, that's the cliche, but it's a time where it clues us in that we need to start becoming every day and calling family members to come say their goodbyes while we have the time to do that.
And one thing that I love is, it is a cliche that everyone's different, because imminent can be literally, I've seen minutes to hours to days. We've even had a patient recently, oh my gosh, 2 weeks of imminence, and things like that do happen. And I think it's so important to have that support system, to have the nurses coming every day, to have them a phone call away, because it's comforting to know what's happening. I mean, I'm a little bit of a control freak, for those of you who are watching this and know me. So I like to know what's going to happen, because things that you don't anticipate tend to be a little scarier, I think. And like, do you explain imminence to your patients whenever it's coming?
Yeah.
Or not just their patients, to your family, to the family?
Yeah, you want them to know, because you want them to be aware of what's happening, so that way they can say their goodbyes if they need to. They can call other family members to come out, or they can FaceTime them, or they can do whatever they need to, basically to...
During this time, I know everybody is FaceTiming, and I'm so happy that, that's awesome. It's, we're able to communicate at least with some sort of face-to-face technology. But it is a very hard time, and just so all our viewers know, we do take every possible precaution. We have extra sanitizers if facilities or patients or families need them. We are wearing our masks and our gloves and supplying them as well if they need it. Just so you guys know, if you're questioning why we're sitting so close, we are less than 5 people in a room, and the whole place has been sanitized, and we are checked daily for all symptoms and symptom management. If you have any questions or concerns about hospice or about COVID-19, we have nurses on staff and standby who would be willing to answer your questions. Anything else you guys want to add to our awesome webisode today?
If you want a consultation, you can give us a call.
916-858-1440.
Thanks for listening. Have a great day.